थैंक यू सो मच डॉक्टर मनीषा काळे मैम। मंजिलें उन्हें मिलती है जिनके सपनों में जान होती है, सिर्फ पंखों से कुछ नहीं होता, हौसलों से उडान होती है, असं आपलं व्यक्तिमत्व काळे मॅडमचं। आणि आज आपल्याला त्यांनी आपल्या या वेबिनारमध्ये प्रमुख अतिथीय भाषण देऊन आपलं जे कौतुक केलं त्याबद्दल आणि आम्हाला जी प्रेरणा दिली त्याबद्दल मी मॅडम आपले या ठिकाणी धन्यवाद मानते। आणि खरोखरच या आजच्या विषयावर आपण जो प्रकाश टाकला तो निश्चितच आजच्या काळाची गरज आहे। यानंतर हौसलों की तरकश में कोशिश का तीर जिंदा रखो, हार जाओ चाहे जिंदगी में सब कुछ, मगर फिर से जीतने की उम्मीद जिंदा रखो, असं एक विचारशील व्यक्तिमत्व म्हणून आपल्याला जे लाभलेले आहेत ते माझे आदरणीय गुरु माननीय डॉक्टर गुल्हाणे सर। I would like to request Dr. G.L. Gulhane sir, Chairman BOS of Education, Head PG Department of Education, Sant Gadge Baba Amravati University, Amravati, to express your keynote address on today's webinar topic. Respected Gulhane sir.
Namaskar, am I audible?
Yes sir.
Good morning, one and all. I am Dr. Gajanan Gulhane, Head Postgraduate Department of Education, Sant Gadge Baba Amravati University, Amravati. Respected Sri Deepak Ji BODKHE, Secretary, Yasho Gatha Shikshan Prasarak Mandal Akot. My friend Dr. Mohan Khatar sir, JD Higher Education, Pune. Respected Dr. Manisha Kale Madam, Dean Faculty of Interdisciplinary Studies, Sant Gadge Baba Amravati University. Today's resource person, my colleague Dr. Mahale Madam, Yashwantrao Chauhan, Maharashtra Open University. Dr. Lingayat Madam, Principal, Government College of Education, Buldhana. Vajpayee Madam, Wardha. And the principal of this college, Dr. Vaishali Ragde, NARMADABAI BODKHE, ADHYAPAK MAHAVIDYALAYA Telhara. And the convener of this webinar, Dr. Vaishali Kankade, and all the organizing team members. I express my sincere thanks to organizing member and particularly the principal of this college for giving me an opportunity to share my views on mental health and COVID, that is opportunity and challenges. What are the challenges that we shall discuss because of this webinar? In this session, we shall cover the points. That is, everybody knows, though we shall just revise what is the mental health, what is health, what are the basic characteristics of mental health, why mental health is important. Then we shall move to the term COVID-19 and particularly its symptoms. These are very, very important. Then how to protect, because we are in pandemic situation, lockdown over, unlock is going on. But after post-lockdown, how to protect the impact of COVID-19 on our mental health. And then also we shall discuss, because we are teacher as well as parent also, we have to take care of our child, kids. So taking care of mental health of children during lockdown period or unlocked period, that also these points will cover. As we know, corona virus is spreading across the globe, everybody know. And feeling of fear, anxiety, sadness, uncertainty are normal during the pandemic, everybody knows. But I think what I have gone through the research paper and studies, I think if we are proactive about our mental health, particularly our separate particular mental health, each individually, then we will be able to fight against present situation during the post COVID-19 lockdown period. Now let us discuss, see, what is health, and then we shall discuss what is the mental health. So everybody know, but just I am revising because this is the common and standard definition given by the WHO. So what is health? When we say that health, we are healthy. Healthy means health is given a state of complete physical, mental and social well-being. Again, I am repeating, physical, mental, social well-being, not merely the absence of, we can say that, disease or infirmity. According to the WHO, mental health is a state of well-being in which, or a state of, we can say, well-being in which every individuals realize his or her own potential. What are my potential? How can I do? Which can be I can do? And how can cope with the normal stresses of life? How can we control the stress? How can I work productively and fruitfully? And is also able to make the contribution to her or his community. If all these characteristics have any person, then we can say that it is, we can say, mentally fit. Now, let us discuss this definition in detail. Discuss the characteristic. Then we get the complete idea of mental health, and then we shall move to the corona, and then we shall correlate with corona and mental health. Mental health is more than just absence of mental illness. Mental illness is different thing, and mental health is different. It includes how you feel about yourself and how you adjust to your life with the events. However, the National Mental Health Association cites 10 characteristics of people who are mentally healthy. Let us discuss, let us compare these characteristics with yourself. First one is they feel good about themselves. I would like to ask a question myself. You can ask to yourself. Am I feel good about myself? If yes, then we can say that you are, or I am mentally healthy. Means we have to give the answer. They feel good about themselves. Means, am I feel good about myself? If yes, then we can say that it is the healthy. Second is they do not become overwhelmed by emotions such as fear, anger, love, jealousy, guilty, anxiety. On that, this second characteristic, you can just frame the question to yourself and ask the question: am I overwhelmed by fear, anger, anxiety? If no, then you are healthy. If your answer is no, then you are healthy. Third one is this person healthy. They have lasting and satisfying personal relations. Am I having lasting and personal relationship with others, with my friends, my colleagues? If yes, then we can say that we are, or you are, healthy person. Next one is fourth is they feel comfortable with other people. Means you can ask the question to yourself. I always ask the question myself. Am I feel comfortable with my friends, my colleague, my family? If I'm getting the answer yes, then I will say that I am mentally fit. Next one is they can laugh at themselves and with others also. Can I laugh at me with others? If yes, then we say that I am healthy. Similarly, sixth one, they have respect for themselves and for others, even if there are differences. Though there are differences of opinion, but we have to respect. Am I having respect to myself, for myself and others? We should have respect myself, own, and my colleagues also. Then I will say that I'm healthy. Next one is they're able to accept life's disappointment. So many, because so we cannot fulfill all the expectation. Every time we will not success in your life. Every time, sometimes you have to face the difficulties, disappointment. At that time, am I able to accept life disappointments? If yes or no, who will give the answer? Myself. If I am able to give the answer yes, then I will say that I am, will say that healthy person, mentally healthy. Next one is they meet life's demand and handle their problems when they arises. Any problem, any life demand, they can easily handle. Can meet any problem you can easily handle. Next one is they make their own decisions. Sometimes we have to take the decision without the help of your colleague, your brother, your mother, sister, or your teacher also. Am I able to take my own decision? If I have that type of ability, particularly taking decision, then I will say that I am mentally fit. So again, I am repeating, why mentally fit? Because we have that potential, that quality. It should be, we have to develop. If you are not, then we have to develop. And last characteristic is very important, WHO. That is, they shape their environment. whenever possible and adjust to it when necessary. Means, am I able to save my environment? We always social contact. Anywhere I'm ready, I'm able, I'm helpful. Then and then only you will be the mentally health. These are the about the mental health. Why mental? What is mental health and what are the characteristics? Characteristics means apart from definition, so that we will get the clear idea. Now we shall see the 3 points. Again, I am repeating why mental health is important. So many is because this webinar topic is also mental health related, and Kare madam has given the highlight on the mental health. And without mental health, you will not survive in the life, I think. So these 3 points I'm placing in front of you. If why mental health is important? Because it affects your relationship with other. I have shared my one slide is also there. This couple is sitting on the one sofa and they are not seeing to each other because they don't have they didn't understand to each other. They don't have a relationship with others. Means that's why if you have mental health, healthy person, there will not a problem like this. Now, second is if you don't have mental, you are not mentally fit. I will say that. Then it affects how to learn. This is very very important for the students and teachers also. If you are not mentally fit or not mentally healthy, you will not I will say that you will not able to attend to, you will not able to concentrate on your study. Your classroom conduct, teachers are not healthy, not mentally healthy, is not able to concentrate in his or her class. Students are not able to understand. Simple thing he is not able because he's thinking in different, maybe anxiety, maybe fear, phobia. Means ability, he cannot able to organize the matter. A very principal is there, if he is not mentally fit, he is not able to run the institute. Even in the family also, he will not run the family, will not correlate the person, will not take the decision. So it will, that means learning process affected. Listen, ability to communicate, he will not able to communicate with the person, other person also. So this is about the second important, and last important is very very important that I would like to share this three pictures, images also, so easily you can understand. If mental health problem can lead to others problem, very, as you know, addict to alcohol, addict to any habit not normally accepted, smoking, drugs. So this the person move toward this one. Second is being hostile and aggressive, become aggressive, immediately react. If anybody say anything, hey, you don't know, who are you? Like this, they react. And third one is these people take the risk in the behavior. Now see that third person, he is driving the car and with the help and at the one side, and he is calling the one person. These two things, how can one person do? Because he is not mentally fit. He is not able to think about the present scenario. So this is the about three important points about the mental health. Dear friends, I have presented in front of what is mental health, what is health, what are the some important characteristics, and then why mental health is important in your life. Now we shall move to the important thing, that is Corona. Go Corona, everybody know. What is who introduced Corona? That we shall just simply 3 slides, 4 slides I will share with you. Corona viruses are a large family of viruses, not a single. N number of minute particles, nano, some points. Then regular bacteria, bigger size, which may causes illness in animal and humans. In human, several coronavirus are known to cause respiratory infections, ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. Very, very sensitive and infectious disease. No medicine available, no vaccine available in every world globally. No one is ready to prepare the vaccine. Since last 4, I think December, that's how COVID-19 means introduced by WHO in December 19. It is given the name. Co means coronavirus, corona, VI means virus, D means disease. And that introduced in 19, that's why name is COVID-19. Now, dear friends, this COVID-19, that is coronavirus disease 19, is the infectious disease. That means just one problem. If you are not maintaining the distances, you can easily affect. Caused by most recently discovered coronavirus. This new virus and disease were unknown before outbreak began in Wuhan, China. You already know that lab in the Wuhan in December 2019. That's how we call it COVID-19. It's a new pandemic affecting many countries globally, not in India, America, Japan, China, all developed country. They are facing so many problems because of only one disease, single disease, not able to control. Last slide I would like to share with you. Everybody know, though again I am repeating, because today Amravati we have Janta curfew. In Jalgaon also curfew, Aurangabad also. Government is not able to control, and I don't think that after 15th of this month, again everywhere in Maharashtra we were under the lockdown because there is no any alternative. So most common symptom of the COVID-19, there are three main symptoms that I have shown by picture also. One is fever, high fever. Second is dry cough and tiredness or some pain in the throat. So apart from this one, other symptom also that less common and may affect the patient include pain, nasal congestion, headache, so many others also. But important three: fever, cough, and dry cough. These are the three main symptoms. Now, important 10 points I would like to share with you. This 10 point again 6 point for the students. Now, this 10 points that I'm sharing with you only to protect impact of COVID on mental health. How to protect? What precaution to be taken during this post-19 COVID-19 or unlock, or we'll say that lockdown. We don't know when will lockdown will again begin. So first point I would like to share with you, because everyone since morning to evening just turn on the TV or mobile and watch the news. I think we have to set the limit. If you are watching TV, news, reading the news, it will increase your anxiety. So that's why I mentioned here, turning into media stories that talk about how fast an illness is spreading or how many people are getting risks. Every day we are reading every 20 cases detected in Amravati, 50 cases detected in Akola, and Akola is higher, more patients than Amravati. Mumbai is very terrible in condition. So these news that impact on your brain, and ultimately that will increase our anxiety. Again, move to the mental health that disturb our mental health. We have to be very careful. What is the precaution here? Set the limit. Morning, early morning, 15 minutes you allot for the seeing the news, and evening. That's all. Instead of this one, another activity we shall discuss. Second is regular social contact. What is social contact? Means because we are in the lockdown, we are at home. So if your movement, suppose your movement are restricted, keep in regular contact with the people, close friend, your regular relatives, your principal, because they are away from this one. At least 3-4 call. Make the list of your list of the numbers. Every day 5 call you can call and just discuss with them. Share the ideas. So easily you will be mentally fit. I will say that. Second is sitting posture, because most of the people are working at home. My son is also working from home. He's on the, but every day people who are sitting in the home, they have to take care of their sitting posture. That is also important. I'm sharing that views, that image of that lady. She is sat with in front of laptop, So regular check your sitting, and after 1 hour, this scientifically, physical directors they have shown proved. If we are continuously sit on a one place for 4 5 hours, that will increase your anxiety, or they may trouble in your back pain. So best way, after 1 hour, take break and stand up and just press like this. Then easily you can just maintain your health positions. Now next one is seeking professional help. I have again sharing that animation slide. I know that everybody one is perfect. No one is perfect in your world, in yourself. So if your mental health is being impacted by stress of the coronavirus, because I know that I talked with the spoken with my friend, those are staying in Mumbai particularly. If we listen their stories, ultimately that will also affect our daily routine also. Because so many people are affected. We are staying in the Vidarbha, we are not so many affected. If you go to the other metro city, it's very difficult to survive there. A licensed mental health professional can help you. You can call them, anyone. Then you can take the help from this person, so we can easily reduce your stress, fear also. Next one is have a routine. This routine, these 6 7 points I have mentioned. This, if you possible, I follow this point. That's why I have written this one by one. Get up and go bed at similar time. Let try to go to the bed at 10 o'clock or 10:30. Unnecessary, don't waste, don't see the movie up to 2 o'clock, 3 o'clock. You'll not get the sound sleep. 10:30 is better. And early morning, 5 o'clock, get up. Keep up with the personal hygiene that everybody know. Eat healthy meal that everybody know. That is important point that also I will share one slide also. Exercise regularly. Why I'm telling you to get up early in the morning, because morning time is best. You'll get fresh oxygen. And early morning, if you do the yoga exercise, that will help to reduce your stress and you will become the mentally healthy. Because of that, especially I'm telling you, because of this COVID-19 period, we have to concentrate on the exercise. Just last month, we have celebrated 21st June, that is International Yoga Day. Other country also, they are believing that yoga is the part of life. Make a habit. Without yoga, without exercise, nobody will survive. No? I don't know that. I don't think that medicine is the last alternative. I think yoga and exercise is the last and final option if we survive physically fit and mentally fit. And second is allow the time for working and time that we have to decide, and make time for doing the thing and enjoy this work also. Next point I would like to this one, that because as you I salute the person, those who are working day night, particularly nurses, doctors. They are just like more than, I think, soldier on particular on the boundary border. They are giving the service to the nations. We have to salute them. So take the opportunities online or through your community to thank them, because because of them we are surviving. We should respect the persons, that is the person who are giving our health. They are taking care of our health. Next point is social media. Though I am telling you that, though we are in the home, we are home because of some lockdown and other thing. We should use the social media, Facebook or Twitter, or so many, everybody knows that. Use the social media account to promote the positive and hopeful stories. Correct misinformation wherever you see. Unnecessarily they are just uploading. So you can just correct it and send some positive information, because we are teacher. That is our responsibility. We are using the social media. What is the purpose of social media? Social media is one of the way of learning, teaching also. So we can share our good ideas about yoga, about exercise, or good habits. You can share with the person. So many, we are taking the webinar also on our university. C4 Kale madam is, I think in that he is under her department. In our department, we have one studio also. So we are just doing using this social media to help them to improve the mental health. Next one is video game. I suggest, because I would like to see that Tom and Jerry, whatever, I don't know that cartoon. Because if you see the cartoon, if you play the video game, will be some from apart from that stress, anxiety, fear, we'll get something different. We will divert the attention from the that everyday news, coronavirus. So you can play it can be tempting to spend much more time on them than usual when at home or period. And last two is very important. That is, we are related. I think that is possible because we are not going to the hotel or some fast food. That is not good always. But best way, if you want to improve your increase your immunity power, because there is no vaccine. Everybody know, globally, no one is ready to tell that this is the medicine or vaccine to control the coronavirus. So vaccine is in front of you. That is that slide. That is, eat healthy food, drink warm water, make regular habit, because these are correlating with your mental health. Our webinar title theme is mental health and COVID. We are under pressure of corona. How to survive from this corona? That we have. You see, I talked yesterday. I spoken with that person, doctor, one of the doctor that is in the super specialist hospital. I asked him, which treatment you are giving? He said, only we are giving the vitamins tablet 1, 2, 3, A, B, C, whatever maybe, vitamin C, vitamin A, and hot water and hygienic cleanliness, only thing, and steam bath, steamer. So best way we are in the at home. Why not to prepare the healthy food? Instead of wasting that money to the doctors and giving to the other activity, why not you invest in the purchasing of food? So eating healthy diet is very important during the COVID-19 to prevent or to fight and to recover from the infection. Every day, eat a mix of whole grains like wheat, maize, rice, or beans, plenty of fresh fruits and vegetables. So many fruits, whatever seasonable fruits you can purchase and wash and then use. And last point I would suggest, that is very important, because I believe on that. Every day I am doing 3 hours I am spending on this point. That point is daily exercise and yoga. If you want to become perfect, fit, physically, mentally, emotionally, I think particularly this period, there is no any alternative. Earlier also I raised that point. So practicing yoga is an excellent way to strengthen the immune system and relax the mind. Early morning, that's why I suggested get up early in the morning, 5 o'clock, 4:30 is the best, 4 o'clock is also better and best. Do the meditation, yoga, exercise, Surya Namaskar. Definitely you will get energy from it, because we have energy inside, hidden energy. We have to just open it. So then second point is, there are some yoga postures that help stimulate organs and piece up their function. And try adding this yoga asana to your routine. I will say that make an habit. Every day we just brush morning like this. You have to morning get up and sit with the carpet and do the yoga. Or so many YouTube channel available. You can take the help also. I have joined the online class. Every day morning I attend the class, because I know everybody world realize that there is no any alternative. So we have to follow daily exercise and yoga. So these are about the what I say that these are most important 10 precautions. Precaution, I will not say the advice. I will say that request you only take the precaution to be taken during post-19 pandemic situation. Then and then only you will survive. You will be mentally fit. I will say that, because mental health, I already narrated definition of mental health given by the WHO. If you want to mentally fit, so we have to follow these 10 what we call precautions. So many points are there. Only I have selected. These are all literature I read published by the WHO. From that points and on the basis of my experience and research, I have highlighted here. Look, now we shall discuss. We shall move to which care of mental health of children, because we are teacher. Apart from teacher, we are the parent. We are the we can say that mother, father, brother. So we have to take care of your child. So again, I am sharing 6 points on this point. How to take care, how to interact with your child at home. Previous 10 points, general points, everyone. Now I am concentrating the precaution or care, taking care of your child or your students, those who are in their houses, their home, they are online, they are learning. So we have to take care of this one. So first one is provide assurance whenever needed. Now see, assurance means, now see, it's very difficult because we think in our potential or abilities. Child think their potential or our potential are different. Their thinking power is different, our thinking power is different. Older age, their thinking power is different. We cannot compare because no one is unique in the world. Though I am a father, I cannot say that you follow this guideline or follow this rule. But no, not possible. I like yoga. Some they will not like the yoga. They may do gym also. There are different varieties are there. So it is important to assure your children, listen to their concern and try answering their queries related to the outbreak or related to the corona. I will say that because they are also listening to your discussion. They will read the paper also. They watch the news also. Unnecessarily they are under stress or fear. So spend some quality time with them and give them the attention to need. It's very, very important. And so yes, day before yesterday, I read one news because the person, 25-year-old, I think Delhi's newspaper, he has detected positive corona, has suicided on the 6th floor. So because of this one, they are not secure. So we have to assure them, like this is general. So provide assurance them and reading them stories. Suppose you have kids, you can just use some books, some novels, online novels also. You can sit with them and read the stories so that they will get the assurance. Her second point out of 6, anxiety. Anxiety is very, very dangerous, particularly adolescents. In this age is very difficult. And that age, we have to watch your young child and observe their behavior. So avoid giving judgmental when they express their feelings. Do not avoid their questions related to the COVID or speak to them harshly. This can increase their fear and anxiety. Instead of this one, make them understand that things will be better if we take proper care. Remember that this is the new situation for your child and also for you, we also. The corona came first time. We didn't have any experience how to handle. So because of we are elder, we have more experience than young children. So we can easily understand, we have to manage the child. Third one is, I will say that keep them in contact with their friends. Allow them to talk with their friends. Simple, very, very simple thing is I am sharing with you. But this will affect, let them to, you give the phone call, mobile phone and let them to speak with their friends. They will enjoy. So they will come out from the fear. That means physical distances from friends can be a cause of distress for the children. Encouraging them to talk with encourage them. Why? If they are speak, they will feel better. Next one is give them clear information. Again, I am repeating. This is very, very important. It is not advisable to provide children with a lot of reports and news related to the outbreak or related to the corona. However, it is important to give them correct information. What is happening? How to care yourself? That is also correct, clear information. And next one is engage them in indoor activities. I have shared the slides also. You can just play playing card, carom, some small games, indoor games, or some puzzles also. If you play with the child, become the child. I will say that. Though you are younger, you are officer, you are teacher, you are professor, but in the house, you are just you can become the friend of your child. On the phone also, you can become the friend of your students. Just ask some question, discuss, encourage them to make the hobbies also. Pick up a hobby, involve the children in some stretching, the exercise, yoga, dancing. You can dance, you can sing song, sing the so many any activities you can do with your child, so that there will be health. Purpose of this one is there will be healthy atmosphere in the family, because since morning 6 to next day morning 6 we are in the home, same faces we are seeing every day. Ultimately there will be irritation, so there should be a change should be there. Make a routine of learning. That is also one of it. Though as you know that online learning classes already started. Maharashtra government, I think 4th, 5th standard, from 4th or 5th standard, online classes are. We are also conducted in the last month online courses, ML students. So in the for your kids, if the students are engaged, we have to sit with the students, check their homework, let them to feel comfortable while doing the assignment, because online learning is very stressing. I don't believe, I'm not accept for the up to the 10th class students, up to 15-year-old students. Online learning, chatting, everything is good for the higher classes. That is better. There is no any alternative. MOOC Swayam we have started. But for younger child, we cannot pressurize them. You have to learn online. You have to complete a homework 3 or 4 hours. I have seen 5 hours students are sitting in front of laptop and mobiles. One of my teachers told me, "Sir, my mobile is with my kids because they are solving the homework assignments. Their teachers are giving their homework." So students are busy with their online learning. That may also affect indirect effect on the mental health. So we have to take care of this one also. This is about the last point of the taking care of mental health of children during the lockdown periods. Now this is about what I have discussed with you. I mean, I will not take more time because this is the webinar. I know that after 30 minutes, 15 minutes, 30 minutes, nobody is ready to listen. And there's so many difference between the webinar and seminar. I will conclude here. So from the beginning, what I have highlighted here, what is the mental health? How to take the precaution? What are the characteristics? Why mental health is important? So everything we have to be very careful. Now I am sharing 3 slides here. These are very, very important. I think this is laminated slide. Now these are the 2 families are there. So one person coming from one family to second family. So we have to keep the distancing. Whenever you want to go outside, even morning walk, use the mask and sanitizer. So avoid these types of the behavior if you are doing. If you are anybody, you can stop here. Second is wash hand regularly, because there is no any medicine. Only soap dot, detergent dots can kill that virus. Wash hand regularly and follow this one and make a habit. I know that is very difficult, but accept it. We didn't know, we have not heard about such type of situation earlier, and not read also. 100 years ago, somebody told that there were plague or some disease came. Like this, we are watching here, we are experiencing what is corona. So first precaution is distancing, maintain distancing. Second is wash hand, and last one is, I believe there is any no alternative, because already I discussed with you, this coronavirus is respiratory. That means from your nose, here we can just, this virus enter in your throat, and after fifth or fourth day, it entered in your lungs. Once it entered in the lungs, so your respiratory system will be spoiled, and there is no any alternative ventilator or oxygen. These alternatives. So many young doctors died last month. I have day before yesterday, I discussed with one of the friend. He was surgeon, but he could not survive. Though he was doctor, they took the precaution. Doctors are more serious about we people particularly, but they are also affected. So this corona is not a simple disease. I request you, all of you, so very carefully. Some of the people, they are thinking we are in the rural area, we should no need to take the care of, but don't just believe on that one. Anything, anytime, anything happen. Just like coronavirus, man is just like an atom bomb. The person who is coming to you, meeting with you, nobody knows, and that person also doesn't know whether he is affected. Once he entered in your house, it will, whole family will be disturbed. So last slide, I always share with you. So we have to, your approach, need to change the approach toward the COVID. I believe if you do the exercise, yoga, eat healthy food, regularly maintain your habit, no corona will enter in your house. No corona will dare to enter your house, I tell you. So we are inviting them. So we have to stop outside the door. So think carefully, read the news, read the literature, or you can spare the time on your working. During this last 3 months, I have done so many work, spending work. I utilize this time for my professional growth. So many people are saying that this corona was because of this corona. I'm not able to do the work. But I feel that I'm able to do the remaining works. So utilize the work properly. This is only 3-4 months. After antibodies will generate in our bodies, ultimately corona will go corona, like this will work, and we will be free. I think in the month of November, December 2021 will be the better, I hope. So thank you very much for cooperation and patience. But I would like to say, stay home, stay safe, and take care of yourself and others. And thank you very much to the organization team, particularly secretary of that institute, and the principal of this, both Vaishali. One Vaishali is my student, second Vaishali also has completed PhD from the department. All these are all B.Ed and all our family, education family. Thank you very much. They have given me an opportunity, and you listen patiently. And I will be very happy if you follow at least 2% from this presentation. And with this word, thank you very much.
Thank you so much, sir, for your knowledgeful and stimulating address on today's webinar topic, COVID-19 mental health. Hello. May I audible, sir?
Yes.
Okay. Thank you, sir. Your knowledgeful address and knowledgeful stimulating speech on today's webinar topic. And sir, your focus on mental health is a state of well-being in which the individual realizes his or her own abilities and about the exercise and habits and your yogas. So thank you so much, sir, for giving us such knowledgeful address.